exposure to antidepressant medication increase the risk of dementia.
Meet Dr. Daniel Amen, a physician and psychiatrist with a mission to revolutionize the world of brain health. Dr. Amen is the CEO of Amen Clinics, which has the world's biggest database of brain scans for psychiatry, estimated to be 225,000 SPECT scans of patients from around 155 countries. Being an influential expert in the mental health industry, Dr. Amen has also authored several of New York's best-selling books on mental health. In this video, we will share Dr. Daniel Amen's 9 warning signs of dementia that might be mistaken for other health issues. As an added bonus, we will also uncover the tips by Dr. Amen to prevent dementia in the long term. So, watch this video until the end. But before getting into the signs, let's first have a look at dementia and its causes. Dementia is a common umbrella term for several memory diseases like loss of memory and problems with cognitive abilities or behavior. It majorly interferes with and disturbs a person's daily routine work. Alzheimer's disease is the most common type of dementia. The mental health diseases categorized as dementia are the result of abnormal brain changes. In addition to cognitive impairment, dementia also affects one's behavior, feelings, and ultimately relationships. After Alzheimer's, vascular dementia is the second most common cause of this disease, in which microscopic bleeding and the blockage of blood vessels occurs.
50% of people who are 85 years and older will actually be diagnosed with dementia, Alzheimer's, other forms of dementia.
Generally, memory loss is highly linked with dementia and Alzheimer's. Shockingly, it isn't the only sign of dementia. There are many other bodily and cognitive issues that aren't limited to memory and brain function. So without dragging it out, let's check out 9 deadly signs of dementia and how to prevent it. The number 1 sign on the list by Dr. Daniel Amen is sudden criminal behavior. Dementia can pose a significant risk to a person's overall personality. People who have never committed any of the smallest crimes in their entire lives may find themselves indulging in strange criminal behaviors. It is one of the first signs of dementia. An individual suffering from dementia is usually confused and might end up snapping when they fail to understand their surroundings.
So, surprising warning signs. You break the law. Law-abiding citizens who suddenly start doing things out of character. You should be concerned.
A 70-year-old woman who has never killed a fly suddenly hits a woman at a supermarket could be connected with dementia. In 2015, a research study in the Journal of Neurology showed that delayed onset of criminal activity could be a sign of dementia. The research also found that different dementia patients were involved in different types of crimes. 8% of those patients were found to be listed on the legal system record. Most of their crimes were trespassing on private property, traffic violations, and shoplifting. Other types of antisocial behaviors, including public urination and fighting, were connected with frontotemporal dementia, or FTD. On number 2, we have frequent tripping. Is there someone elderly who began to trip frequently out of the blue? It might be a clue towards dementia. People struggling with cognitive impairment from dementia might end up falling more than usual and sustain a serious injury. Tripping is sometimes connected with other symptoms of dementia like ineffectual judgment, mobility or coordination, sensory perception, and failure in addressing their needs like help with getting out of bed.
Dementia. Falling more frequently. And when I had Aslan, our white shepherd, who I miss every day, he was always leaving toys around to trip me. And I'm like, dude, who's gonna feed you if I die? Very important to pick up things so you don't trip.
While falls are majorly due to physical weakness in older individuals, others with young onset dementia, especially people under the age of 65, may also trip due to frailty. The majority of falls lead to minor injuries like scratches or bruises. But some trippings also result in more critical injuries like a broken bone. This gives rise to immobility and dependence, snatching away a person's confidence. According to research by the American Academy of Neurology, involving 125 older participants, the individuals who tripped frequently were linked to or had a likelihood of early onset of Alzheimer's disease. Moreover, the study also revealed that the falls alongside changes in gait may lead up to cognitive symptoms of Alzheimer's. The next sign, according to Dr. Amen, is inability to sense sarcasm. Frontotemporal dementia is a generic term used for a group of disorders associated with the frontal and temporal lobes of the brain. During the FTD, damaged proteins gather around the frontal and temporal lobes regions, leading to the death of neurons. Since the ability to sense sarcasm or lie requires the operation of the frontal lobe of the brain, the lack of this skill may be a sign that the person is developing FTD.
Inability to pick up on sarcasm. Now, if you talk to my family, they think I'm pretty funny and often sarcastic. If they're not picking up, either I suck or something's going on in their brain.
A research study by neuropsychologist Catherine Rankin at the University of California, San Francisco proved that the inability to detect sarcasm or lie is a sign of FTD. In the study, Rankin made the participants with or without FTD and others with different types of dementia watch a video of two persons speaking. One of those persons sometimes lied or answered with sarcasm. The participants with no FTD easily detected that the person was sarcastic or lying. However, FTD patients couldn't sense sarcasm or lie. People with other types of dementia like Alzheimer's surpassed FTD participants in performance. MRI further confirmed the research results by showing the visible damage to the frontal and temporal lobes of their brains. The number 4 sign is change in appetite or consuming non-edible food. A person with dementia might struggle with eating food, loss of appetite, or eating more than usual. Dementia causes a person to forget how to chew and swallow, or they might get interrupted by their surroundings. This results in loss of weight and inadequate nutrition. On the other hand, dementia also pushes a person to overeat and have an abnormally large appetite. On top of that, a person may also experience pica, a mental health condition in which people have a craving for and consume non-edible items. Similar to smoking, drinking, and eating junk food for emotional relief, dementia patients rely on non-food items to cope with their stress.
Eating weird stuff, changes in appetite, and the foods you crave, if it changes big time, can be a sign of early.
Pica rarely occurs in adults, but when it does, the person usually has cognitive impairment. This might be happening due to an injury, disability, or dementia. Pregnant women may also experience this health condition. According to a Japanese study, pica was more frequently seen in individuals with Alzheimer's or semantic dementia than in people who suffered from different types of dementia. There isn't significant research conducted into pica and how it occurs, but a theory suggests that a damaged or malnourished brain might not distinguish between edible and non-edible matter. Before moving forward, it is important to note that this video is intended for educational purposes only. The signs discussed herein are not intended for self-diagnosis or for initiating over-the-counter medications independently. It is imperative to consult a qualified psychiatrist to obtain a professional diagnosis and to pursue an appropriate medical approach. The next on our list is gum disease. Gum disease or periodontal disease is basically an inflammation or infection of gums and bones underneath the teeth. Its symptoms include gum bleeding, loose teeth, bad breath, and swollen gums.
Gum disease. Gum disease? If you have gum disease, odds are you have an increased risk of heart disease and brain disease. Floss. See your dentist. Get serious about taking care of your gums. It's absolutely critical to the health of your brain.
A research study in the Journal of Periodontology suggests that gum disease may give rise to dementia. While gum disease is also linked with heart disease, the bacteria that causes gum disease is also a risk factor for Alzheimer's disease. Scientists have discovered that the bacteria from the mouth travels to the brain. Once in the brain, the bacteria release enzymes that destroy the nerve cells in the brain. This leads to memory loss and ultimately Alzheimer's disease. The sixth sign is the sudden development of compulsive behaviors. People with dementia may showcase out-of-the-box compulsive behaviors like continuing to carry out the same task, asking a similar question again and again, or sometimes even developing a new behavior or habit. For example, folding and unfolding a napkin, repetitively checking the locks of windows and doors, or becoming a hoarder.
Engaging in compulsive behaviors. If you hadn't, and that's not been your story, but all of a sudden you start collecting things or you have to do things a certain way, you get upset, it could be a sign your brain is deteriorating.
A neuroimaging study through SPECT scans uncovered that 38% of the participants with FTD and 10% with Alzheimer's showed compulsive behaviors. Another research in the Journal of Neuropsychiatry suggested that people with early FTD had compulsive behaviors that were largely impulse-driven because of damaging shifts to the frontal lobes. On number 7, we have another sign: loss of sense of smell. The reduced sense of smell, which used to be associated with the COVID at first, is now linked to a different health condition. A study at the University of Chicago showed a link between an Alzheimer-related gene and a reduced sense of smell at the age of 65. Moreover, the loss of sense of smell could also signal a more serious neurodegenerative disease.
Your sense of smell is off. In fact, a smell test is one of the early tests for dementia. So working out your olfactory nerve, working out your sense of smell, really important.
The study involved around 365 people who participated in the experiment at 5-year intervals. During the tests, DNA samples were also collected to learn which individuals had the Alzheimer-related gene. In addition, researchers discovered that the participants who carried this gene had 37% less likelihood of detecting odor than people who didn't have this gene at the age of 65. However, at the age of 75, the participants who had this gene also lost the ability to identify odors. The next sign is having clinical depression. If someone is experiencing persistent sadness, it might not be just a mood issue, but a broader concern. It could be a sign of memory impairment, the inability to sleep, irritability, and agitation. The favorite foods starting to appear off-putting. These are the signs of depression, but also a risk factor for developing dementia.
Depression is often a prodrome of dementia. In fact, if women have problems with depression, it doubles their risk of Alzheimer's disease. If men have depression, it increases Alzheimer's fourfold.
A study published in the Archives of General Psychiatry discovered that people who fall into depression late have a 70% likelihood of developing dementia, while people who experience depression from middle age carry an 80% chance of dementia. Researchers have been acknowledging that dementia and depression are interrelated. However, it is still unknown whether the two conditions have the same root causes or if depression is a sign of dementia. Furthermore, the study suggests that developing depression later in life shows that some damage has occurred in the brain, making an individual more vulnerable to dementia. Before we continue, if you want to learn more about how you can protect your brain and reduce your risk of dementia through simple lifestyle changes, make sure to subscribe to the QuickTime newsletter linked below. Each week, we share expert-backed insights on brain health, diet, and wellness, along with actionable tips to help you stay sharp and live a healthier, longer life, straight to your inbox. The last one on our list of Dr. Amen's signs of dementia is struggling with ADHD or other mental health conditions. Similar to developing depression as a sign, other mental health conditions including ADHD can signal the arrival of dementia. Adult ADHD is regarded as insignificant, and people with ADHD are seen as eccentric and disorganized. Therefore, the majority of adults with ADHD remain without diagnosis and treatment.
But if you have untreated ADD, you're more likely to get dementia because it increases other risk factors such as head injuries, alcoholism, obesity, sleep problems, and so on. So,
while ADHD can contribute to many challenges, including risky driving, substance abuse, and early death, new research directly associates it with declining brain health. According to a new study in the JAMA Open Network, attention deficit or hyperactivity disorder in adults increases the risk of developing dementia 2.77 times more than people who don't suffer from ADHD. Another research study published in JAMA Psychiatry showed that people with mental disorders had an increased likelihood of acquiring dementia. For the evaluation, the researchers studied the hospital records of 1.7 million people in New Zealand between the ages of 21 and 60 between July 1988 and June 2018. They grouped 9 sorts of mental disorders, including substance use, psychotic as in schizophrenia, mood as in depression, neurotic as in anxiety, physiological disturbance, personality, development, behavioral, and other disorders. Out of all the participants, 3.8% had a mental disorder and 2% had dementia. People with mental disorders had 4 times more probability of dementia onset than people who didn't suffer from any mental disorder. These were the deadly signs of the onset of dementia shared by Dr. Daniel Amen, but he has also uncovered methods to prevent it in the long term. Let's have a look at the easiest way one can safeguard themselves from dementia.
the other thing you said, which is also really important, is sleep. People who get less than 6 hours of sleep at night have lower overall blood flow to their brain, and their memories are not good. So making sleep a priority is absolutely critical.
So, we've just covered the 9 deadly signs of dementia that everyone should be aware of. But even if you're keeping an eye on these signs, there's something else you might be overlooking. Your daily habits could be playing a bigger role in brain health than you realize. So, watch this next video to uncover the top lifestyle changes that Dr. Wendy Suzuki recommends to protect your brain, boost mental clarity, and lower your risk of dementia.